Apollo 247 application, where you go and look for information through our COVID helpline within the application. Also on your assessment of your COVID risk status, which you can always do by clicking the link on the Apollo 247 app. While we are waiting for the session to come back online, I request all of you download the 247 app if you haven't already downloaded it, and look through the features, just play around with the features and see how it is and give us your feedback. And it's primarily about accessibility and how easy is it for you to consult a health expert, a doctor, or a dietitian, or a physiotherapist, or name the specialty that you have there available with us. Well, I think the session has come back online. Let's see if the video is going to play for you. I will come back and connect with you soon again. Thank you. Thank you for your patience.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine.
Okay, good morning again. I'm sure all of you had to look at the video a little bit. Apologies for that. Apologies for the disconnect that we've had. Well, I think let me introduce to you a concept of what this show is all about. I'm Dr. Neetal. I'm from Apollo 247, and we are here with my team of experts to talk to you about, things around COVID, multiple things around COVID, myths, beliefs, doubts, clarifications. You need responses. We have that for you. So a lot of things that are coming through the show now. And we will also talk to you about, in this situation, in this limited, space, in this restricted enough, a place where it's the need of hour, the time of the need of the other, the current situation, and how do you take care of things? How do we help you take care of things is what we're going to talk about. I have my colleague, Mr. Raina from Apollo. So we are going to, host and take you through the whole session of engaging with the specialist, with an expert, also show you some exciting information about what to do while you're at home or elsewhere. Mr. Raina, good morning. How are you doing, sir, today?
Namaste. I'm doing good. How about you?
I'm doing perfectly good, sir. So thank you for being here, and it's an amazing moment for us to have you on the show, and we have other guests coming in as well. So just to take it forward, we have today a lot of myths, a lot of doubts, a lot of questions that people have today. And the basic things that we need to talk about today is, how do I keep myself safe? What is that I need to do to keep myself safe? Is it something big, small, a mask, or just a basic sanitizer, or isolation, or quarantining myself, or, there's so many things. Do I eat a vitamin C? There's so many things that are hovering around. So if we could address that through a simple solution that Apollo has today, that you can, at a click of a finger, order a sanitizer, hand sanitizer, which is so easy for you to use. It'll actually, alleviate all your infectious processes, your hygiene. It's all taken care of, right? So when that happens, all you need to do is practice this. Use a sanitizer that we have, that Apollo has. You can always visit the app, order for a hand sanitizer, and it takes care of your hygiene on the hands at least, right? So coming on to the next, thought process, Mr. Raj, Raina, what do you think that is hovering around today? What your experiences a little bit in, around Corona.
Yeah, namaste everyone. See, let's start with some good news coming from Delhi. So two things, the recovery rate in Delhi, it has improved to 86%, whereas the national recovery rate is hovering around 63%. Delhi has gone up to 86%. So that is something good news coming from Delhi. The second good news coming from Delhi is the positive rates have come down to 5.7%. Now, as experts say, if the positive rate comes to either 5 or less than 5, by and large, we may able to control the disease. But I think we'll leave that point to Dr. Rakesh Gupta when he comes in next. Now, in mid of this good news, whether it is positive rates coming down or recovery rates going up, at no point of time. So my request, at no point of time, we should take this coronavirus casually.
Easily, yeah.
Now,
true.
What does that mean? We should follow all the safety precautions for ourselves and for our family members at home. So now, what are those safety precautions? Basic safety precautions by wearing a mask, maintaining physical or social distance, the regular hand washing, and also keeping a multi-surface disinfectant spray. Now, अभी तक आप सब लोगों ने सुना होगा कि mask क्या है? Mask. Everybody would have heard about mask. Everybody would have heard about social distancing or physical distancing. Hand wash videos, everyone knows about it. But what is this multi-surface disinfectant spray? What does it do? How it helps us or our family members? From where you can get it? Dr. Neetal, I would request if you can take us through about or tell us more about this surface disinfectant spray which is available now in the market. What are its uses? What does it do? From where people can buy it?
Yeah, it's a very simple spray like we always have in our houses. Anybody can go into Apollo 247 app and type in the spray and it throws up information. You just buy it and it's delivered to your house. So this is how it looks. We're going to play a small video for you to show you what this disinfectant is all about.
Here's how long the coronavirus will last on surfaces and how to disinfect those surfaces. Paper material, 24 hours. Fabric, 24 hours. Glass surfaces, 4 days. Copper, 4 hours. Plastic and stainless steel, 72 hours. Disinfecting surfaces is the primary way of controlling the spread of virus. At Apollo hospitals, we use multi-surface disinfectant spray. It's the most convenient and safest way of disinfecting surfaces.
Well, I'm sure all of you had a look at that. It's just a simple spray and you could go to Apollo 247 app and you can order it from there. Well, Mr. Raj, thank you for your information. I think, I just would like to ask you one question because a lot of people think, what did Delhi do differently and how is it getting contained? It's a metropolitan place. It's a huge place, lots of people, a huge population, but I'm sure there are a lot of steps that have been taken. So if you can just brief a little, just one liner about what makes it interesting for us to listen to the good news that the cases are dropping down and,
Two things, Dr. Neetal. So one was the aggressive testing which Delhi government did, and
exactly,
second was the public awareness drive on home isolation.
Public awareness, that's so important.
Yes, yes, so the public awareness drive on home isolation made the people realize that they could recover in their own homes also. So there was no point in coming to hospital and getting admitted there. Okay. So by and large, it was that scared, that the people, they had scared feeling of COVID. So that probably was going off by this public awareness drive. So on one hand they were testing the people, and on the other hand they were advising the people to stay at home and self-isolation. That probably worked for Delhi.
So so it's important. I think everybody should follow that, make people more aware of it. Everybody says, I know about it, I know what to do, but it's not as simple as that. You need to follow it, you need to practice it and educate people who are not following it. That is very important. Thank you for that, Mr. Raj. So while I take you to the next session, we have a lot of more events that are coming up, and we have a quiz session. We will answer your questions. Mr. Raj is here. Dr. Rakesh is going to be here. So I would request Mr. Raina to go forward and introduce Mr. Rakesh, Dr. Rakesh.
Okay. Before Dr. Gupta takes over the show, let me introduce him. So it's a great pleasure and honor for me to introduce our eminent speaker for the today's program. Dr. Rakesh Gupta is working as a senior consultant in internal medicine department at Apollo Hospitals, New Delhi since November 2000. His core area of expertise covers the comprehensive management of diabetes, critical care, and related complications. Besides being expert in managing metabolism and lifestyle disorders, he has been actively involved in handling emergencies and critically ill patients in various ICUs. Dr. Gupta is also a part of Apollo COVID team and has been involved with the treatment and care of COVID patients over the last few months. Dr. Rakesh Gupta is also involved as a teacher with Diplomate National Board program in the hospitals. He was conferred with the Fellowship of Indian Academy of Clinical Medicine in 2002. So ladies and gentlemen, please welcome Dr. Rakesh Gupta.
Good morning, sir.
Good morning, friends, and good morning to all people who are tuned in. Hi. Should I start?
Yes, sir.
I think you've given me a few minutes to kind of set the ball rolling by kind of talking about COVID-19. I think most of our people who are listening in are so full up with COVID-19 information. And I think all kind of information has been coming in through the media, through the online and other channels. But I think it's worthwhile to kind of re-assimilate all what we know till now, and then perhaps take in the questions which the audience wants to say. We're talking about COVID. We're talking about coronavirus. It's a very, very strong foe. It's enemy. It's not a foe. It's really an enemy. And I think it has come up with a bang with us. Just to get the ball, see the timelines which has come about. The first time we heard about this virus was in November, December this year, when first time the news came from China about this virus. But suddenly then it really exploded, and in all the countries in the world, almost every country in the world got affected. And ultimately the government, the WHO, declared it as a pandemic on March 11th, 2020. And thereafter, every government has been trying to kind of streamline things. And we also have gone through lockdowns and all kind of programs over a period of time. And here we are still grappling with the problem. The problem is so worldwide that I was looking at the figures today, 16 million cases in the world till now, out of which 6 lakh people have died. In India itself, we have had around 13 to 14 lakh people, out of which 32,000 people have died. In Delhi, we have around 12,600 active cases as of now, but the total caseload is around 1.3 lakhs. And in a population of the city, which is almost around 2 crores, and the death toll in our own city is around 3,800. So we're looking at a very strong enemy, and that is why the fight comes about, and the community as a whole really has to come about. So, we have been looking at this coronavirus. Basically, it's the virus which is specifically causing this COVID disease. COVID means coronavirus disease. It's caused by SARS-CoV-2 virus, which is basically a full form is severe acute respiratory syndrome virus, basically. And the presenting symptoms of this condition and the infection which happens, we are quite familiar with. Patient comes with fever, patient comes with cough, you may have sore throat, you may have shortness of breath, and a couple of other odd symptoms which we have not really figured out in the beginning, but now we are all familiar with. Loss of smell and loss of taste is a very specific symptom which a patient has in these cases. And you may have, along with that, gastrointestinal symptoms like nausea, vomiting, diarrhea. The problem comes, the problem goes. Most of the healthy people do very well. The case fatality is not that much, but the problem happens more when a patient has comorbidities. And I think that is where the picture becomes more murky. Quite a few of us after a certain age tend to have problems of medical issues. Either you have blood pressure, or you have coronary artery disease, the heart problems, or diabetes, or blood pressure, or you may have cancers of some sorts. You may have even kidney diseases. So all this group of people, generally they have more problem tackling this problem because of body immunity being less and other complications being there. And that is where probably the most focus of the community and the doctors in the hospital is. Most of the patients who are admitted with us in the hospitals generally do very well, and most of the patients actually go off also without any problems. But some of the people who have these comorbidities, they have a lot of problems, and we really need to tackle them with a strong focus, basically.
Dr. Gupta, I'm so sorry to interrupt you. So, this information that you just said is so important and so informative that, it educates people more about it. Now, if I can just ask Mr. Raj, to highlight on a few myths and questions that you may have, or which we've been listening from people that we could request Dr. Gupta to, respond to us. That'll be great, Mr. Raj.
Yeah, yeah.
Sure. Sir, there is one common question, when everybody is asking is, what is this viral illness about? Is it the same virus, or the illness is similar to other viruses, or it is different? And why we are struggling to fight it, sir?
There are a few reasons why we are struggling to fight this particular virus. The human body had not kind of found this virus in the past, and we were not kind of should I say, challenged in the past with this virus. So you know that it supposedly has come from wet markets of China, and initially it was found to be in bats and other animals, and then it came to the human being for the first time. And whenever a human body faces a new challenge, then it takes time to develop antibodies against those kind of challenges. We already have in our with us flu viruses, flu vaccines which are given every year. We have vaccines with us for even pneumococcal illnesses. But this new virus has not yet kind of been seen by human beings.
Is it a new strain that you're talking about, Dr. Gupta?
The new strain, coronavirus, was there in the past also, but this COVID-19, which we are talking about, this particular strain, seems to have come from animals, which we were not familiar with. And that is why, and another thing which is causing a problem, the incubation period of this virus is pretty long. Generally, the incubation period of most of the viruses is just around 4 or 5 days. But we have seen incubation period in this case up to 14 days. So, it takes that much time for a patient to become non-infectious, even if a patient is infected with it. And during that period, the patient has a potential to kind of communicate the illness to other people. And that is why all this quarantine and 14 days and 17 days
Correct.
kind of recommendations are coming. These are 2-3 main things why this challenge is more, particularly as compared to the other viruses which we have had in the past.
Which is why I think the vaccine preparation, also getting it ready, is getting to be a challenge.
I think everybody is waiting eagerly for the vaccines.
I know.
There's no magic wand as such. We also hope that vaccines come. When they come, they come. But biologically preparing a vaccine, going through the trials, it is a challenge in itself. And although all the governments and all the companies are fast tracking it, and we may get it sooner than what we get in an average vaccine, but let's not kind of wait eagerly for it to come as soon as possible, and that will be a magic wand. Till all that time happens, we have to protect ourselves. We have to be careful, and we can't let this virus win over us as many other illnesses in the past have. Just to give you an example, just to in this same topic, in 1918 we had a Spanish flu, and it wiped out around 3% of the world population. Now 3% is a huge figure. Now we're talking about 2020. So we hope that this virus and this flu does not affect so much, and it doesn't take so much toll in its in the background by the time it goes off. So I think just to learn from what we have learned in the past, protect ourselves and treat ourselves. And just in the same goal, let me also answer this question. A lot of people ask me really that, doctor, what is the treatment for this? According to me, there is only one treatment, and that is protecting it yourself. The only treatment is prevention. Prevention is the only treatment per se. I think, and that is a message which
we've had a lot of questions around people asking us when we have mild symptoms, which could relate to corona kind of symptoms, or no symptoms at all, but I'm exposed. Do I rush to a hospital? And what if I need a surgery? What will happen? So those are the things that are coming in from questions from people. How do we address that, Doctor?
So I think let me answer this question by a simple way possible. I think everybody knows how to protect themselves in the house. All the media and all over the last 4 months. You need to wear a mask. You need to wash your hands regularly. You need to isolate yourself, etc. But what I have noticed as a doctor is that people make basic error in certain things. For example, I've got a mask with me. And just to tell you that how we wear a mask and how we take out the mask, that itself is a challenge. Everybody knows how to wear a mask. As an example, probably this is how you wear a mask generally, which you have. Now you see, this is a mask which you wear. Now, why are you wearing a mask? You're wearing a mask so that to protect yourself from any other particles which might come to your surface. And second is that you yourself do not spread the infection to others. So while wearing a mask is fine, no problem. But when you put in a mask, a major problem which I've seen in most of the patients is that people keep on fiddling around with their mask. A lot of people I've seen which kind of adjust this mask like this, adjust this mask like this, adjust this. Please don't touch the front surface of the mask once it is worn. There is no way you can touch the front surface of the mask. You go outside to a market, to a restaurant, you eat, you come back after 2 hours, and please don't keep on adjusting your mask. That spoils the whole purpose of the mask. You're protecting yourself, and if some particles get stuck, it will come to your hands and it can spread. So when you come back home, for example, the way to take out the mask would be just use these strings which you have at the back side. Just put your mind face forward and take it out. Please don't touch this front side. A lot of people, what they do is they kind of use this mask, and then what they would do is they will just take out this thing and take it out. Don't do it. Yeah. Please don't do it. So this is one thing about a mask. Now, a lot of patients tell me, doctor, when do we need to see you, or when do we come to the hospital? I have mild symptoms, like you said. One of the ways to check yourself is, do you have any of the typical symptoms which are bothering you? And one of the major things which we can see in our houses, and you must have read in papers also, regarding the saturation, the oxygen saturation which you have. Correct. Now, we have a simple gadget here. Now, this is a pulse oximeter, which I think people are well aware of. And it doesn't cost much to have it. I think it's just around $2,000, $3,000. And if you have a pulse oximeter in the house and you simply use this pulse oximeter and you kind of put your finger here and you kind of see this will tell you very clearly what is your oxygen saturation. If an oxygen saturation of an individual is above 95, then you don't need to seek any help. You don't need to come to the hospital. You can jolly well be home. But if your saturation is consistently coming below 95, please seek advice immediately. For example, this is my saturation, and you can see it's around 96 or whatever. So ultimately, 95, the saturation should be one way to assess yourself at home. And if suppose your saturations are around 90, 92, then walk around a little bit for 3-4 minutes, 6 minutes, and then again see your saturation. If your saturation is consistently above 95, please be at home. You don't need to be in the hospital. But if it's below that, please seek help from your doctors. So these are 2-3 simple ways to kind of look at that. Your doctor is your best friend. I think he's always available to you. And do discuss with him your problems, etc. I think I'll go out to say that please don't treat yourself. I think we do have home remedies, and all our patients do try to use home remedies in their own way. That's their choice. But professionally speaking, I would say that don't play around with these viruses beyond a certain stage. Contact your family doctor, contact your hospital, and be in touch with them regularly if you contact the disease.
Thank you so much, sir.
Thank you.
एक और क्वेश्चन है जो काफी लोग जानना चाहते हैं कि अगर एक ही घर में, एक ही ऑफिस में, if there are 4 people, किसी में asymptomatic है, किसी में mild symptoms हैं, किसी में severe breathlessness आ रही है, कोई ICU में जा रहा है. So why it is affecting differently in different population or different subset of people, sir?
वो इसलिए क्योंकि हम सब लोग इंसान डिफरेंट है. हम सबका जीनोटाइप डिफरेंट है, हम सबका फिनोटाइप डिफरेंट है. आप एक अलग इंसान है, मैं एक अलग इंसान. हो सकता है आपको डायबिटीज हो सकता है मुझे ना हो सकता है आपकी इम्यूनिटी बेटर है, मेरी नहीं है. हो सकता है आप नॉन वेजिटेरियन खाना खाते हैं, मैं नहीं खाता. हो सकता है आपका विटामिन डी, विटामिन B12 लेवल्स बहुत अच्छे हैं, मेरे नहीं है. So every case is different and we can't generalize. So all the recommendations which are made, जो भी एक हमको information मिलती है, वो population के लिए generally बोली तो जाती है, लेकिन हर इंडिविजुअल अकेला होता है और हर इंडिविजुअल कैसे टैकल करेगा प्रॉब्लम वो डिफर करता है. तो एक 80 साल का जो इंसान है उसकी एक कैपेसिटी फाइट करने की अलग है. एक 30 इयर्स का आदमी है उसकी फाइट करने की कैपेसिटी अलग है. अगर मुझे पहले टीबी हो चुका है या मुझे कैंसर हो चुका है या मैं क्रॉनिक स्मोकर हूं तो मेरी फाइट करने की कैपेसिटी कम होगी. लेकिन अगर मैं हेल्दी हूं, मैं हर रोज जॉगिंग करता हूं, मेरी लंग कैपेसिटी अच्छी है, तो शायद मेरी फाइटिंग कैपेसिटी बेटर होगी. तो हर केस डिफरेंट होता है, तो इसलिए जनरलाइज नहीं आप कर सकते. हर केस को इंडिविजुअली देखना पड़ेगा और उसके बेसिस पे ही हम डिसाइड कर सकते हैं कि पेशेंट को कैसे टैकल करना है, कैसे नहीं करना.
Thank you so much, sir. The other thing which nowadays is in news is the vaccines. There are a lot of stories coming in, media is covering. So by when we can have vaccine, and will it affect? Will it be effective? Is India is also into this race of getting a vaccine out in the market? So what is this vaccination?
ये कोई $1 million question नहीं है, ये $1 billion question है, according to me.
Yeah.
So to be honest, कई vaccine companies चल रही हैं. At least 160 companies and governments all over the world are fighting for the vaccine. और एक vaccine के trials और वो सब चल रहे हैं. But let me tell you honestly, as a clinician, vaccine बनाना और निकालना इतना आसान नहीं होता. This is not one of those easy things. इसमें human body involved होती है, इसमें trials involved होते हैं, इसमें various stages होती हैं. मेरा personal opinion है कि vaccine शायद इस साल के end से पहले ना आए हमारे पास. I think towards the end of this year or maybe early next year तक vaccine आ जाना चाहिए, 3-4 वैक्सीन बहुत ही प्रॉमिसिंग है. हमारी गवर्नमेंट और ये बायोटेक कंपनीज जितनी भी लगी हुई हैं और हमारे इन्होंने शुरू भी कर दिया. आपने पढ़ा होगा ट्रायल एम्स में शुरू हो गया, पहले इंजेक्शन लग गया लोगों को और वो सेकंड ट्रायल, सेकंड स्टेज 2 स्टेज 3 के ट्रायल्स हो रहे हैं. ऑक्सफोर्ड वाले जो हैं एस्ट्राजेनेका के साथ मिलके एक उनके ट्रायल अलग चल रहा है. एक गिलियड एक कंपनी है, उनके ट्रायल्स अलग हैं. सो अब व्हाट आई ट्राई टू से इज बहुत मॉडर्ना एक कंपनी है जिनके ट्रायल्स है, गिलियड की मेडिसिन है. सो ऑनेस्टली स्पीकिंग हर कंपनी अपना ट्राई कर रही है अपनी तरफ से कोशिश. एंड आई थिंक जितना फोकस दुनिया में है आएंगी वैक्सीन, बट लेट्स नॉट बी टू ग्रीडी. इट विल कम ऑन इट्स ओन टाइम. जब आएगा वील ऑल वेलकम इट, बट एज ऑफ नाउ अगले कुछ महीनों के बाद ही आएगा ऐसा लगता है.
Thank you so much, sir.
Thank you.
Dr. Neetal, you have any questions for Dr.
Yeah,
Neetal?
I think I was just thinking while sir was talking about it, and while we have a lot of questions coming up from the participants, they've been asking us, what should an infected person do with mild symptoms or moderate or severe symptoms? What is the trigger for admission?
I would say the first thing is that if you suspect COVID, then get in touch with your family doctor, and he's the one who's going to guide you about how to do the testing and all that. Yeah. आपको पता है there are many kind of testing available also. Correct, so blindly getting antigen testing or antibody testing is not fair. Your doctor is your best friend. On the other hand, once you are diagnosed with COVID, then no need to rush to the hospital per se. Majority of the patients can be tackled in the house only. But like I said, you have to meet your family doctor who can guide you accordingly, whether you go by online discussion or if you don't want to come to the hospital. A lot of people are scared of coming to the hospitals nowadays. They feel कि हम hospital जाएंगे तो हमको COVID हो जाएगा, which I think is another myth which should be busted here and now. You know, every hospital worth its salt knows how to tackle their patients. Correct. So according to me, as far as, for example, I'm working in Apollo. Apollo has a completely separate unit for COVID and separate entry, separate ICU, separate set of people involved. And on the other end, the normal entry for all other non-COVID cases is different. So I don't think so anybody should be scared of coming to the hospitals. Hospitals are bent and geared up for treating patients per se. So be in touch with your doctor, and he's the best person to judge whether you can be managed in the house or you can be coming to the hospital. Like I said, this pulse oximeter is one of the gadgets which can help you in kind of judging whether you need that. But if you have a high-grade temperature, if you have breathlessness, and if you have fair amount of comorbidities, I would say all these comorbidities like we were talking about, blood pressure, cholesterol, heart conditions, lung conditions, oncology patients, dialysis patients, those patients we have to be extra careful. And if you have any of these more comorbidities, 1 or 2 or more, immediately I think you are a more vulnerable patient than the others, and you definitely should be in touch with your doctor. Now, every patient doesn't need to be admitted to the hospital. That is one story. And every patient who's admitted to the hospital is not necessarily to be admitted in the ICU. He can be in a ward, he can be in a room, or he may need to be monitored per se. And he may need an ICU also. So there are different kind of cases in a different way. Your doctor is a person to guide you. Or you can come up to the casualty of the hospital and kind of consult the doctors on duty, which are open 24 hours, and everybody has a family physicians who can guide you the best. And that is the way to go forward. Please don't go by what media says. Please don't go by what WhatsApp University says. I think you have to meet your doctors who are your best friends.
Thank you, doctor.
Thank you so much. Thank you so much, Dr. Gupta. Now, in fact, Neetal, Dr. Gupta, rightly was, bringing out the points of the symptoms, the signs and symptoms, whether it is fever, whether it is fatigue, and there is one symptom which is also now, people are becoming very cautious about is cough. Ki khansi bhi hai, one of the symptoms. Now, cough can be, productive, cough can be dry cough. Is there any way, what the person can, come to know, okay, fine, this is the kind of cough and I should now get in touch with the doctor. Probably this cough is like, getting into the COVID kind of a category.
The truth of the matter is that cough is a symptom, but illnesses are of 100 types. You can have cough of side effect of medicines. You can have cough because of COVID itself. You can have cough because of TB. You can have cough because of normal cough and cold, which most of us have. You can have cough because of change of season. So there can be 100 reasons for cough. So if you have a symptom of cough and you have a symptom of fever, of course, when there's a pandemic going all around, then your first thought is towards COVID. But there can be many other reasons which can be a cause of cough. So like I said, you can't jump to conclusions on your own. Ultimately, it's a medical healthcare worker who can guide you best regarding that. And you really need to kind of sort out advice from the doctors before kind of jumping on your own. Many investigations help us. Doing a chest x-ray or doing some sputum testing also helps us. And even CT scan, which is considered one of the major tests which are required in a patient, who might have COVID also, which have specific symptoms, are also part of the armamentarium of the doctors when they are treating patients. So ultimately, like I said, please don't panic on your own. If you have any of those symptoms, sort out with your doctors, and they are the best people to guide you per se. In the same quote, just before I forget, sometimes, you jump from one topic to another. I must also point out, regarding prevention. Another thing which probably all TV ads and everything says that wash your hands very well. So, everybody knows how to use these kind of things which we use as sanitizers and all. But there is a particular way in which hands also should be washed. So I think I would like to demonstrate amongst public also for 20 minutes, 20 seconds, when you wash your hands, how should you wash your hands actually? So you put this thing here and then you wash first like this, then you wash like this, then you wash like this. You have to kind of touch everything so that your hands are washed very well. These are some ways, and anybody can download on the online. I think the media is kind of doing so that every part of the hand is touched. Just simply pouring it and just washing like that is not the way to do it. So there's a particular way to do it, which is very easy to get hold of. And once you do it 10, 15 times, it will become a part of your habit. So that even your tips of your fingers and even your hands and your thumbs and all other areas are touched. So I would recommend that all our people who are listening should also kind of inculcate this habit of washing your hands properly so that you can be protected from the illness.
Thank you, Doctor. We have some questions coming in the YouTube participants. It's about how do we sanitize the products we buy from the market? Any meat products or any vegetables or any groceries we buy?
I have read a lot about all this, and everybody keeps on giving their 2 pence worth of opinion. And there are hypochlorite solutions and there are sprays and all that. But I think the simplest way to kind of take care of vegetables and fruits is to kind of wash them in running water.
Absolutely.
The best is to have a running water, not standing water.
Correct.
So if you take whatever fruits and vegetables, for example, in my own house, when we get fruit, and my wife is a doctor herself, and now, like I said, we all have become cooks also, and we become multiple roles also.
Yeah, I know.
Had over the last 3-4 months. So what she does, the vegetables and fruits which come to the house, they are first washed in a running water, the pouring water. After that, with a clean cloth, you kind of dry them, and then just let them dry them completely. And after that, they're good enough to be used. So you don't need to use any chemicals washing plants, fruits and vegetables.
So that's the answer. Yeah.
Running water, cold running water if possible, but even the normal running water is good enough. So that's for that.
Excellent.
And I think if you get stuff from outside sources, like for example, you get some square box of something, or you get some plastic thing, then perhaps you can kind of wipe it with the hypochlorite solutions, which all of us have, and there are sprays. Or probably one of the easy things to do is just keep it in sun for 48 hours or so that if there are any kind of organisms and all, that can just go off. You showed in the video initially that in that surface, probably it remains for this much time. So if there is no urgency and it's not an organic product, it can be kept in the sunlight for some time, 2 days or so. And that would be good enough for most of us. And we don't really need to do anything more than this.
Thank you, Doctor.
Thank you so much. Yeah. Now, in fact, Dr. Gupta very clearly brought out, one thing, that if you have some symptoms or signs like fever, cough, or, the other things which we just talked about, that don't stay at home, or just, the doctor should be the best person to guide you further. Now, Dr. Neetal, now in this current scenario, where people are afraid of going out of their home, visiting the hospitals, how can we help them, to access the quality healthcare from the best doctors in India? How do we help them?
Yeah. So today, 20, 30 years ago, we had to have patients come to a hospital or to a clinic and talk to a doctor. But today, we have an app called the Apollo 247 app, where it's patient-centric. We are reaching out to people who are further away from us, right? They don't have to come all the way, travel all the way, and make it unsafe for them. Instead, we give them an opportunity to connect with the doctor, with a specialist, with a super specialist. Close to 6,000 doctors who are on the platform today can be accessed 24/7. Isn't that amazing? It is, because people never knew who to go to. They didn't even know who a medical oncologist was. They didn't even know who a pediatric nephrologist was. Today, they have access sitting at their house at a click of a finger to connect with the doctor. So we will come through that, the application of how this app works. And I'm sure all of you would have downloaded already. If not download, please download it right now and go through the features of see how we can access healthcare or order medicines or order diagnostics from the Apollo 247 app. Before I just go on to the next one, there were two things that Dr. Gupta talked about was the cough that you had asked, Mr. Raj. We have a very interesting, tool where people can assess themselves, which I'll come in the next session. But before that, there were a couple of questions that on the YouTube that were asked about, vitamins, Zincovid. Every second individual buys Zincovid. There's Zincovid not available in many stores. Vitamin C. They don't listen to anybody. Why? Because this whole viral thing came up in the WhatsApp saying, use Zincovid. Arey, Zincovid use kar le. Treatment के लिए wait मत कर, तेरा immunity बढ़ा ले और ले लो जल्दी. खरीद लो vitamin C or start having it. Give it to everybody in the house. So if you can just tell us a little about what that myth is, and is it really necessary for us to have these?
Thanks for asking this question. And I think let me put it in black and white.
Yeah.
Being an allopathic doctor, you go by evidence and you go by what
Absolutely.
offers
Yeah.
you per.
Yes.
If you ask me, doctor, is there any evidence that zinc and vitamin C, especially these two things, are acting as immunoboosters and they help in fighting COVID in particular? My straight answer is no. The answer is no. None of the studies have specifically proven that. But yes, there have been anecdotal reports which have said in the past that whenever you have viral illnesses, these vitamin C and zinc both act as boosters to the energy. For example, all our life we have heard that if you have common cold, for which there is no treatment, vitamin C was something which we have been using in the past, and you have Nibu Pani or whatever. So, the truth is that technically speaking, vitamin C and zinc and any of these immunoboosters have not been recommended by the doctors per se, but the patient generally kind of wants to take something to boost their energy and immunity. Then the next question always is, "Acha, doctor sahab, agar hum isko le lein, to koi harz hai kya?" This is the question they ask.
I know.
So
Yeah.
answer the question as a doctor is, well, it's your choice. If you
Yeah.
really believe in them and you want to take it, fine. I don't really want to say anything to that. But
Correct.
I would say, as of now, there is no recommendation which specifically says that taking a zinc and vitamin C is useful for us. So that is what I can tell you the stated position as of now.
Okay, thank you, sir. Thank you very much. So let me just take you through a list of features that Apollo 247 app have. I'll request my team to just display the information there while I can talk to you about the Apollo 247 app. Now, this is an app where you have, it's an omni-channel, which connects you to a doctor, talks to a specialist 24/7. You can order medicines from there. My colleague will talk to you about a little about how to order medicines and what's the expertise in delivering of medicines that we have today. So we have pharmacy delivery. We have diagnostics that are done at home. At the click of a finger, people will come to your house and collect samples, and give you results online. You can have all your medical history, your medical details, your records, everything online, your prescriptions online. So you do not have to carry anything anywhere. However, we have a very interesting feature, which is called a Corona self-risk scan, which talks about how do you assess yourself against Corona? How do you know that you're at risk, you're at moderate risk, you're at high risks, right? So this is a very interesting tool called Cough Analyzer Cough Test, where you just cough into this. You go and click online, cough-scan.apollo247.com. This is a very simple exercise that you cough for a few seconds, and then you answer very few simple questions about your health, like you have fever, cough, or any other disease or any other condition like hypertension, diabetes. This assessment tool gives you an information about what risk you stand. And in case there's a moderate to severe risk, what do you need to do? Which specialist do you need to consult? Where to go? Who to call? All this information is given here, and at a behest of just a click of a finger. And this information is extremely private and secure. You do not have to really worry about this information going out. And please use this link to assess yourself and the cough risk score. So that was a question that Raj had asked Dr. Gupta about being worried about cough. So even before you go to a doctor, go please do a scan and it will help you assess your condition. Now, coming back to the Apollo 247 app, we have a very, very, distinctive feature, which you can actually call our doctors who are 24/7 on the helpline to give you information about the Corona, right? That's one of the features that we have. Also, we have a very, very interesting feature. It's not just a consultation with a doctor and doctor forgetting about you. It's about managing you at home. How does it happen? Whether you're hypertensive or a diabetic. We have a program called a chronic disease management program, which is a complete detailed digital therapeutic program where we manage these chronic conditions at home. We have psychologists, we have counselors, we have motivational experts, we have diet and nutrition specialists, we have doctors, we have nurses who are engulfing you with trying to manage you at home. We don't just leave you by giving you one medication and say, okay, manage it, come back after 6 months. No, we still are with you. We still will help you engage into a proper healthy protocol and have a manage a good quality of life. So that is what a condition management program does. Now, going from here, Raj, we were talking about, and Dr. Gupta also was talking about multiple, scenarios where people at home, they do not know what to do. Right? I have some symptoms. I came into a contact with somebody. What do I do now? So we have an excellent program called Apollo Kavach program, which assists you to take care of you at home, and you can isolate yourself at home. Our doctors or specialists will talk to you while at home. You can consult them anytime, 24/7. And we have these packages that you can see now, 300 rupees per day, which is the basic package, which you can avail, where it will enable you to talk to a physician and to a nursing supervisor also. And advanced package where a nurse, a physician, a doctor, a motivational expert, a rehab expert, a dietitian, and a counselor will continue talking to you for that period of isolation. So, all you have to do is just call this helpline at Apollo Kavach program, and you can just sign up for that while at home, or we can check in self at the hotel as well. So you have a 24/7 nurse sitting at the hotel, taking care of you, all your needs, healthcare needs, and also talk to a doctor for your 14-day period. So we are here for you. And Apollo Kavach program brings you these two models at home and at the hotel as well. So while you're at home, if you can recall that you need a lot of things. You need materials to take care of your masks, your sanitizers, your pulse oximeters, and thermometers and other things. Now, how do you get these? You don't have to scatter yourself, go to one medical shop and buy this, but this is a package that we have, which is a 6,000 rupees package, which is available on Apollo 24/7 app. All you have to do is just go search for this package and you order for it, and we come and deliver you within 6 hours. So this is a package that comes to you, and you can have it as a kit at your house and use it for everybody, right? That's what I can recommend. And Dr. Rakesh, if you've known about this, and Mr. Raj also, how do you feel? Is this kind of good? Is it really working well? Because a lot of people in Delhi are using this. And if you can, give a little glimpse from experience, what this is all about. And we have a video for you, which shows you how a pulse oximeter works as well. So what do you think about that?
Looks very promising, to be honest. And it looks like getting everything under one roof as compared to people buying individually. I think all of us are familiar with the sprays and sanitizers and hand washes and 3-ply surgical masks and all that kind of thing. I would have been happy if and pulse oximeter, or you also added onto it, isn't it?
That's it.
That's very important. Pulse oximeter is something which probably would go very well. So I think it really virtually covers up everything which one
everything can. Absolutely. We have a small video for you for all the participants to see how the pulse oximeter works, which Dr. Rakesh had shown already. So here it is.
Coronavirus can cause hypoxemia, leading to lower levels of oxygen and may cause breathlessness. Early detection of hypoxemia is essential during the COVID-19 pandemic to avoid critical conditions later. Easily keep a check of your blood oxygen levels at home. Pulse oximeter, easy, convenient and safe.
Thank you so much, Dr. Neetal. I think the other thing, we're probably, when we were talking about the 24/7 app, since Dr. Rakesh has been using this app, to give consultation for his patients, let's ask him, what has his been experience with 24/7 app, and, how user-friendly it is, how it has helped his patients to connect with him during this pandemic period. So can you just tell us more about this, your experience with 24/7 app, sir?
Yeah, Raj. Being a clinician by training, we always like to lay our hands on the patient. And till the time we don't touch the patient or take their pulse and don't take their blood pressure or don't have face-to-face, we have never been comfortable till now, at least. But these are abnormal circumstances. These are rare circumstances. And in this case, probably the next best thing after that is one of these apps which you have, like 24/7, in which a patient from the comfort of the home can talk to us What I've seen is, I've used this app for last 3 months now. What happens is that patient sends me his reports, which are quite a few of those patients are my follow-up patients who have been showing me in the past. And quite a few of them are from outside Delhi. They are from Bihar or Assam or wherever. And you know that physically it's not possible nowadays because of flights and all those kind of things. So they post me the reports. They post me the latest reports which they have. Post me the prescriptions they have. I have the prescription myself. So we can discuss, okay, how have you been and what's been. So you can say this is the best way we can go virtually. And the app helps us in connecting it in a good way. In a select timing, the patient kind of gets to see the doctor also. That also is a psychological, I think, thing that one connects with the doctor. And most of them have been regularly visiting us in the past. And even some patients who are fresh and new, who have not seen us in the past, seeing a doctor and kind of discussing face-to-face and answering queries like probably we are talking as of now, is much reassuring than simply having a telephonic conversation or just writing down a prescription. So I know it is not a great substitute for actual consultations which we have had all our life, and we hope at some point of time we go back to that. But this is the second best thing which can happen. Until the time the things get normalized, I think 24/7 has been a useful app for my patients, and most of my patients are very happy. We kind of look at everything, we discuss the things with the patient and send them the prescription in a written format so that they can kind of download the things and they can get it from their local pharmacy and they can be in touch with us till the time this whole pandemic thing goes off. So I think I'm very happy with this app, and I think it's shown good results over a period of time, and most of my patients are very happy with it.
Thank you so much, sir. Now, since we are talking about the pharmacy thing also, people how to, once people have been advised a prescription on 24/7 app, so how do they order the medicine? So I think we have another guest with us, Mr. Arpan, who is from Apollo Pharmacy. He's Senior Manager Marketing from Apollo Pharmacy. He will tell us briefly, how you can order medicines right sitting at home. So Arpan, if I may ask you, if anyone wants to order medicine for family members who are staying at different locations, how can they do that?
Sir, at the outset, namaste from Apollo Healthcare Group, namaste from Apollo Pharmacy. Okay, very informative session. I have been all ears, all through for the advice that you're giving. Special thanks to Dr. Rakesh Gupta, Dr. Neetal, Rajji, aapko bhi, like amazing tips you guys are giving us, and you're busting a lot of myths. Yeah, coming to the question that you have asked me, that can I, sitting at a particular city, like let's assume I'm in Delhi, and my parents are say in a Lucknow or a Jaipur. Can I order the medicines that way? Yes, definitely, sir. The app has an option wherein I can select, I can have multiple addresses in my address list. So for example, I can have my, let's assume I stay in South X in Delhi. I have my South X address as a home address. I have my office address, and I also have a backup address of my parents in Lucknow. So all I need to do is select the medicines, upload the prescription, and select the order for Lucknow. So that way, sitting in my house, I can ensure that the order is delivered in any location where Apollo Pharmacy is present.
Thank you. So now the other thing is, suppose डॉक्टर ने मेरे को सुबह कंसल्टेशन दिया और लिखा कि आप एंटीबायोटिक लेंगे या ये वाली आप दवाई लेंगे और शाम से आपकी डोज शुरू होनी है. Now if I order the medicine from the Apollo Pharmacy online and I have to take the medicine in the afternoon or in the evening, so how fast Apollo Pharmacy can deliver medicines at my place?
सर मैं स्पेसिफिकली दिल्ली एनसीआर की बात करूंगा. पहले हमारे 300 प्लस फार्मेसीज है दिल्ली एनसीआर में. हम दिल्ली एनसीआर के हर कोने में हैं. हम दिल्ली में हैं, हम गुड़गांव में हैं, हम गाजियाबाद में हैं, हम नोएडा में हैं, हम ग्रेटर नोएडा में हैं, हम फरीदाबाद में हैं. तो अगर हमारे पास ऑर्डर सुबह कोई कस्टमर भेजता है, हमारे पास करेंटली भी इतनी कैपेबिलिटी है कि हम 4 से 5 घंटे में ऑर्डर डिलीवर कर सकते हैं कस्टमर तक, एटलीस्ट दिल्ली एनसीआर में. और कुछ अनदर ज्योग्राफीज लाइक से जयपुर, लखनऊ, चंडीगढ़ में भी हम ये क्षमता रखते हैं कि हम ऑर्डर को सेम डे डिलीवर कर पाए. बट प्रेफरेबली अगर ऑर्डर 3 या 4 बजे के पहले हमें हिट करे, हमें 3 या 4 बजे के पहले अगर ऑर्डर आए वाया अपोलो 247 ऐप, हम लगभग 95% ऑफ द केसेस में हम लोग सेम डे ऑर्डर डिलीवर कर देते हैं अगर हमारे पास मेडिसिन और कोई भी प्रोडक्ट्स अवेलेबल हो तो. और सर ना सिर्फ मेडिसिन, हम रेगुलर हाउस होल्ड प्रोडक्ट्स भी डिलीवर करते हैं, जैसे कि टूथपेस्ट हो गए, टूथब्रशेस हो गए, हाइजीन प्रोडक्ट्स हो गए. जैसे आजकल हम लोग काफी ज्यादा सिस्टम पे बैठ के काम कर रहे हैं, तो अपोलो फार्मेसी का खुद का एक बैक सपोर्ट है जो हमारे स्पाइन को सपोर्ट देगा. तो इस प्रकार की काफी सारी प्रोडक्ट्स हमारे पास हैं जो हम दवाइयों के साथ डिलीवर करवा सकते हैं.
Thank you. I think that's interesting part that within 4 to 5 hours, the patient can get the medicine delivered at home.
Yes.
The other thing, काफी लोग ये जानना चाहते हैं कि प्रिस्क्रिप्शन हर दवाई के लिए जरूरी है या कुछ दवाइयां बिना प्रिस्क्रिप्शन के भी ऑर्डर की जा सकती हैं ऑनलाइन फार्मेसी से.
Sir, we follow the market norm. There are certain medicines which need a prescription. Okay, there are certain medicines like, for example, maybe for a crocin we don't need a prescription, or for a saridon we don't need a prescription. These are technically OTC medicines. But yeah, customers might need a few diabetic medicines या कुछ heart related medicines हो या kidney related हो. Particular जो prescription medicines है उसके लिए ही हम prescription मांगते हैं. बाकी जो regular products हो गए उनके लिए prescription की जरूरत नहीं है. और ये हम इसलिए करते हैं ताकि एक तो लीगली कंप्लायंस भी हो, और सेकेंडली एक दवाई में काफी सारे एस्पेक्ट्स होते हैं, जैसे कि दवाई का डोसेज कितना है, कितने दिनों के लिए दवाई चाहिए, इसलिए हम प्रेस्क्रिप्शन मंगवाते हैं ताकि कस्टमर को हम 100% कन्वीनियंस दे सके.
थैंक यू अर्पण जी. एंड हाउ डू वन मेक द पेमेंट? आई मीन कैश ऑन डिलीवरी है, पेटीएम है, क्रेडिट कार्ड है, किस तरह से पेमेंट कर सकते हैं?
बिल्कुल सर, ये ऐप में वी हैव अ प्लिथोरा ऑफ पेमेंट ऑप्शंस. वी हैव कैश ऑन डिलीवरी, द गुड ओल्ड पेमेंट ऑप्शन. वी हैव अ कार्ड पेमेंट ऑप्शन also. So these two payment options currently are there with us, and customer can use any one of these options, but we are working continuously to incorporate new payment options in the future also. So some of the wallet options that you talked about might come in the near future, but as of now हमारे पास कार्ड पेमेंट भी है और हमारे पास कैश पेमेंट भी है. दोनों ऑप्शंस हैं.
Thank you so much. Thanks for being with us. I think there is some health quiz also being part of this program. That's Dr. Neetal. Okay.
Thank you, sir.
Thank you so much. So there is a health quiz which is going on as a part of this program. So you can answer the question over chat. The winner's name will be announced at the end of the webinar. The winners, they have to mail their contact details at marketing@apollo247.com. I repeat, marketing@apollo247.com. The gifts will be delivered at the doorstep. Now, while you are answering you're answering the questions over the chat, in the meantime, we will play a short video about how safe Apollo is. Where Dr. Gupta also was mentioning in the beginning that a lot of people are scared to come over to the hospital for the emergency treatments, or they're postponing their surgeries कि शायद जाएंगे कोविड तो नहीं हो जाएगा वहाँ पे मैं रिस्क पे तो नहीं हूँ. But let me assure you, at Apollo we take all the precautions to keep our patients and our staff safe, whether it is screening process at the entrance, whether it is wearing of the right mask, whether it is sanitization of all the equipments before and after use, whether using the technology, the robotic surgeries or the minimal invasive surgeries, so that you don't stay longer in the hospital, or whether with our ambulance, they are also being sanitized so that we can do a pick up and drop for you with our ambulances. So we are taking all the precautions to keep you safe. So my request would be, if you require any medical treatment, if you require any surgery, please don't stay, please don't prolong. It may land up into complication. We have seen that. Please immediately get in touch with your doctor. He can advise you whether you have to reach to emergency or to the OPD, and we will take care of you.
I think we have some interesting questions for you. Mr. Raj will take you through those questions. And the person who answers first will get an interesting gift. So Raj, over to you.
Okay. What is the name of the Apollo program that offers care and protection against the coronavirus? So I repeat the question. What is the name of the Apollo program that offers care and protection against the coronavirus? So while you answer the question, you know, so what we can do is we can announce the winners later on at the end of the program, at the end of the webinar, and the winners, they will have to mail to marketing@apollo247.com, and the gifts of the winners will be delivered at the doorstep. Okay, now I think we are coming towards the Dr. Neetal. I think there are some gift coupons. Probably, people would like to know what kind of gift the winners will be having it after once they have replied back to the question. So what are the gifts for the winners?
So I think the marketing people will, our marketing team will get back to the patient and give them, the gifts, those special gifts. But these coupons are for everybody. You can actually type in the coupon Apollo247 while making your payment and get a $299 off on consultation with the Apollo doctors, and use this medicine 10 coupon and get a 10% off on pharmacy orders. So these are for everybody. And those special gifts to all the participants will come in from the marketing team. You can write to that email that Mr. Raj has just mentioned, and all the winners will have those gifts. So if you have any more questions, you can push in on any more further quiz that you have, Mr. Raj, you can put it to them. Otherwise, we can end the call.
So what is, okay, I think we are coming towards the end of the program, probably looking at the time also. Maybe the questions can be, shared with them later on. So once again, on behalf of Apollo Hospital, Apollo Pharmacy, Apollo 247, I would like to thank Dr. Rakesh Gupta for taking his precious time out for today's program. Sir, we thank you for being with us today's afternoon. I would also like to thank Dr. Neetal for moderating this program, and Mr. Arpan for sharing the valuable information on home delivery services being offered by Apollo Pharmacy. Last but not the least, I thank all the guests for their presence this afternoon. Your encouragement always helps us to organize important events like this. We thank you for being with us, and it has been a great pleasure interacting with you. Thank you so much. Namaste.
I think you can have around the winners' names also, Raj.
Can I make one final comment? This is one illness in which prevention is better than cure. So prevention is the main thing which we must aim for in this condition. And that's the message which I think we should all take home. Thanks.
Thank you so much, sir.
So we have, Gaurav Agarwal, who has won a special gift for the question that he's answered right in the beginning. So Mr. Gaurav Agarwal, thank you so much for participating, and congratulations. And our team will get back to you, and you can mail us your details on the mail ID that Mr. Raj has talked about before. And